How do you spend your free time? With family or friends? In the outdoors? For people living with advanced stages of chronic kidney disease, free time is precious because much of their extra time is spent in a dialysis unit. In this video, we will talk about how diabetes and high blood pressure are linked to kidney disease. You probably know that you have 2 kidneys. But what do you know about chronic kidney disease? CKD, which is the abbreviation for chronic kidney disease, is a silent disease, and you may not even know you have it. Most people have no symptoms until their kidneys are about to stop working. Our kidneys work around the clock to keep us healthy, yet we often take them for granted.
My doctor did a blood test, he did a urine test, and he even actually did an echo of my heart and of my kidneys, and could see that there was massive damage to both of my kidneys. And when he told me that I had kidney failure, I just cried.
Anyone can have chronic kidney disease. Some people have a higher risk. In the United States, the percentage of whites with CKD is 16%. Hispanic and Latino persons with CKD is 19%, and African Americans is 20%.
In the community where I work, 26% of the population has diabetes. And I know that there's other Indian tribes that the rate is even higher, up to 50%. So it's really important for people to get checked for kidney disease and diabetes.
You are at risk of CKD if you have diabetes, high blood pressure, or a parent, brother, or sister with diabetes, high blood pressure, or CKD. As a matter of fact, diabetes and high blood pressure are the 2 leading causes of chronic kidney disease.
It's my family history that out of 3 kids, from my mother and my father, I'm the only one that has diabetes, but I'm not the only one that has high blood pressure.
Both of my parents have diabetes. My cousin, he uses insulin. My aunt, she's in dialysis. And my uncle, who died by kidney disease.
Well, most people have 2 kidneys. The kidney's job is to maintain the balance of the body's fluid and electrolytes. It sort of works like a filter for the blood to keep in the things that we do need and to get rid of the things that we don't need. The diabetes and the high blood sugars that go along with poorly controlled diabetes and high blood pressure that goes along with poorly controlled hypertension directly can damage the blood vessels in and around the kidneys, and this can cause kidney disease to progress and the kidney function to decline. Sometimes people are bothered by things like kidney stones or kidney infections. But most problems in the kidney don't cause any symptoms, and people aren't even aware that they have problems until really it's very advanced. Chronic kidney disease has 5 stages. Stages 3 and 4 are advanced kidney disease, but still clinically significant, where people often don't even feel that they have kidney disease or are aware of it. Once they reach stage 5, that's when people generally are undergoing transplantation or dialysis. A lot of people think that drinking water is really healthy for their kidneys. The fact is, drinking water is generally good for your health, but it's not going to help slow the progression of kidney disease from diabetes or hypertension.
I'm diabetic, and I realize that that's a risk factor for chronic kidney disease. And I also know that there are other risk factors out there like high blood pressure or a family member who has chronic kidney disease. So if you have any of those risk factors, you should contact your healthcare provider.
As healthcare providers, it's important that we communicate with patients the importance of early testing and screening. Because kidney disease doesn't present symptoms until it's a very late stage, finding it early can really help slow down progression of disease.
There are several things you should do. First, get your blood pressure checked regularly. High blood pressure can be a cause of, but also a sign of, chronic kidney disease. At least once a year, get a simple urine test. The test checks for tiny amounts of protein in the urine. This test is called urine microalbumin. A normal result is less than 30 milligrams per gram creatinine. People with diabetes should have this urine test once a year. You also need to get a blood test to check how well your kidneys are filtering. The test measures your serum creatinine and is used to determine your estimated glomerular filtration rate, or estimated GFR. This number tells you and your healthcare provider how well your kidneys are working to get rid of waste from your body. Be sure you know what your numbers are. Ask your healthcare provider what your estimated GFR should be. If you do not have a healthcare provider or insurance, Call your local aging department, local public health department, or the National Kidney Foundation for more information. Many people don't know they have chronic kidney disease and have no symptoms until their kidneys stop working. The urine test and the blood test are necessary to detect kidney disease early. Chronic kidney disease is serious. When kidneys fail, a person must go on dialysis or have a kidney transplant to stay alive.
It's very easy to get your kidneys checked by a doctor. All you have to do is go in to have a lab test done, some blood drawn, and then a urine specimen.
If you have diabetes, keep your blood sugars at the level that your healthcare provider recommends for you. Also, have an A1C test done 2 to 4 times a year. This test gives your average blood sugar for the past 2 to 3 months. Try to keep it below 7%. This is a general target. Ask your healthcare provider what your target should be. Keep your blood pressure below 130/80 if you have diabetes, high blood pressure, or CKD. Ask your healthcare provider what a good blood pressure number is for you. You may have to take more than one blood pressure medicine to control your blood pressure. Some blood pressure medicines, called ACE inhibitors, or others called ARBs, also help protect your kidneys. People with diabetes may take these same medicines to help protect their kidneys, even if they don't have high blood pressure.
Since I'm a type 1 diabetic, I know that someday I might need to go on an ACE inhibitor or an ARB to slow the progression of chronic kidney disease, even though I don't have high blood pressure.
If you have a family member with diabetes, high blood pressure, or chronic kidney disease, talk with your healthcare provider about your family history and risk for CKD. Ask what you can do to protect your kidneys and how often you should have the 2 lab tests mentioned earlier. If you have chronic kidney disease, treatment is necessary. CKD will not go away, but treatment may slow down how fast it progresses and may help keep your kidneys healthier longer.
I am looking into kidney disease more and more, and the more I find out, the more careful I am about everything I do to, one, control my high blood pressure and to control my diabetes. Because those lead, if they're not taken care of or controlled properly, it leads right into kidney disease, and I don't want kidney disease.
It's important for me to be on an ARB because it is going to either prevent or slow the progression of kidney disease, because having diabetes puts me at an increased risk for getting it.
You can also stay healthier by eating less salt, limiting pain medications, maintaining a healthy weight, eating balanced meals in small portions, being physically active each day, stop smoking and using other tobacco products, avoiding secondhand smoke.
Certain medications can damage your kidneys if you take them often or in large amounts. These include things like ibuprofen, Advil, Motrin, naproxen, or Aleve. Ask your healthcare provider if there are other things that you could do to control your pain, and make sure that you tell all your healthcare providers how much pain medications you're taking and how often.
Here are some other things you can do to stay healthy. See a healthcare provider at least once a year and ask about your kidneys. If you have diabetes or high blood pressure, ask how often you need to be seen. Take all medications that are prescribed for you. Never stop taking your blood pressure medicine or take a lower dose than prescribed. If side effects or cost is a problem, talk to your healthcare provider about other choices. Keep a list of all the medicines and the amount you take, and review it with your healthcare provider at each appointment. Include any over-the-counter medicine, vitamins, or supplements you take.
Some medications like ACE inhibitors or angiotensin receptor blockers, sometimes called ARBs, are very important for slowing the progression of kidney disease. Make sure you know when you're supposed to take your medication and how to take it.
I guess if you don't understand something or you're not clear about something with doctors, nurses, anybody that works in the medical field, I guess the best thing to do is to ask, and then even if it seems like a dumb question or something that you're just unsure of, it never hurts to ask again and again, and even get it in writing if you can.
Sometimes we use big words when talking about your health. If you don't understand something, make sure you ask for help. And remember, there are other members of the healthcare team that can help out with this as well. Your social worker, dietitian, nurse, pharmacist, counselor, or diabetes educator.
Please give me an explanation that I can understand, because you went right over my head, and I'm sorry, but I have to know what you said.
Remember, there are things you can do to keep your kidneys working well. If you have diabetes or high blood pressure, talk to your healthcare provider about getting your kidneys checked. If you have a parent, brother, or sister with diabetes, high blood pressure, or CKD, you and other family members have a greater risk of CKD. Talk to your healthcare provider.
Diabetes is a challenging disease to manage, but I know that it's a lot easier to manage my diabetes well now than to have to deal with dialysis or kidney transplants further on down the road. And as time goes on, I've learned how important it is to make sure that I get my kidney tests done annually, because I only have 2 kidneys and I need to make sure that I keep them healthy.
I would tell people that are at a higher risk of getting chronic kidney disease to make sure they take their medication as prescribed, follow any kind of meal plan that the doctor suggests, whether it be low sodium, low protein. Make sure you keep your appointments, go to see your doctor, just take better care of yourself.
Make sure you get help from your healthcare provider. Ask them if there's any kind of medication that can slow down the deterioration, basically, of your kidneys.
Try to seek advice from other people who have kind of been through the experiences already, and because you can learn quite a bit from individuals who have already kind of ran around the track already.
I know my diabetes and high blood pressure could be give me kidney disease, but if I keep my blood sugar where it should be, taking my blood pressure medication and listen to the advice of my healthcare provider, I'm going to keep my kidneys healthy.
Taking the time now for early detection and prevention of CKD may help ensure that you have the time to spend with the ones you love. For more information, please contact the National Kidney Foundation of Wisconsin at 800-543-6393. Wisconsin Diabetes Prevention and Control Program, 608-261-6855. Phone 211 for other services in your local community.
Please share this DVD with your family. If you have diabetes, high blood pressure, or CKD, then your family members are at risk. You can even share the DVD with your friends and neighbors.